Is that you? Do you feel that way? Do you feel that way certain days where you can't do things, you can't move, and yet other days you can move really well? Do you suffer from spinal stenosis? Do you have these issues? And you're probably thinking, man, I better not do anything because I don't want to aggravate anything. You're living in fear. What can you do to change this? Watch this video. Today, I'm going to show you how you can live with spinal stenosis and live a healthier life. I'm going to show you what stretches you can do to help optimize your function and start living your life the way you want to live. My name is Dr. Shariff. I'm a local chiropractor in Oshawa, Ontario. My clinic name is Infinite Healing Chiropractic and Wellness Center. And our mission on this channel is simple. It is to help teach you how to optimize your health, how to live life to the fullest, how to live life without invasive procedures or surgeries or pills to start maximizing the inner potential you have. So watch this video in its entirety. If you're interested in learning more about your health and how you can maximize your potential, then subscribe to this channel, like this video. You will be informed on when I actually post out new videos. This is all about you and about living your life. So if you're interested in maximizing your potential, watch this video in its entirety. Let's start. So the number one thing I tell clients when it comes to stenosis and it comes to improvement is movement. You have to move. You cannot stay inactive. Sometimes we have a fear of saying, I better not do this, I can't do this, I have to avoid doing these things because it's going to aggravate things. Well, the more you avoid, the more you start living in a cave and you can't do anything. You're limiting your body. You're limiting everything you can do. And when things are limited, they're only going to get stiffer. And as they get stiffer, the pain is going to increase and the degeneration is going to increase and the stenosis is only going to get worse because the inflammation is going to increase. So you've got to move. That's an important thing. And I see people that get inactive, they have fear, they stop moving and they start to lose their ability to do things. So movement is important, okay? That's the first thing. The next thing is chiropractic care. Chiropractic care is essential and stuff, and I find anybody who has stenosis should be seeing a chiropractor. And the reason why is because we're working with your spinal joints, your motion, your nerves, your nervous system. And what is stenosis? It's an impact on your nervous system. Your nerves are getting affected, your spinal cord is getting affected because the narrowing in the spinal cord, the narrowing in the foramen where the nerve is coming out of is decreasing. It's getting smaller. So there's impact in there. So you want to have motion. And remember when I talked about earlier, I said movement is the most important thing for the spine and for the body, especially for stenosis. Well, what are we doing as chiropractors? When we're adjusting joints, we're moving them. So chiropractic care is not harmful. Chiropractic care is extremely beneficial for somebody who's got stenosis, and it's needed. It is important. And so what happens though is that your joints have so much motion, they get fixated, they get misaligned, and scar tissue forms in there. And that inhibits that spine and your body from moving, and you're losing that motion. And that's what you don't want to do because you want to have that mobility. And that scar tissue then leads to inflammation. That inflammation then leads to irritation on the spinal cord, on the nerves. And that starts to impact your body, the way your body functions. And then you start feeling stiff, you start feeling sore, you start feeling other problems starting to occur in your body. And this just compounds, and you get this snowball effect. Rather, by seeing a chiropractor and us looking and finding those misaligned areas and putting it back into alignment, we start to restore proper motion in that spine and suddenly taking that pressure off the nerve, breaking apart that scar tissue, reducing the inflammation. These are all positive factors that help you manage your stenosis better. Okay, and then I'm going to show you some stretches too on how you can also manage your stenosis too. So keep watching as I show you some stretches now too. Now, one thing I'm going to say to you is that before you do any type of stretches, before you start to participate in stretches, you should always consult your healthcare practitioner. You should always go over things with a healthcare practitioner and review this. This is not medical advice, but this is education on how you can improve your health. So the stretch we're showing here is the single leg knee to chest stretch. Basically, the premise of this stretch is that it's going to help to flex the spine. It's going to take the stress off the nerves. And the game plan here is that we're showing this on a chiropractic table, but I prefer this to be done on a floor. And you're going to have your back on the floor, your legs down, your feet on the flat on the floor. Then the first step is you're going to bring your knee to your chest, and you're going to stay on the same side. Now, you want to hold this stretch for about a good 20-30 seconds. breathing slowly and deeply in and out. And I know a lot of people say stretches can be done for 8 to 10 times. I don't need that. I think that it's important that you do it 2 to 3 times, holding it for 20 to 30 seconds, and you get a better and a deeper stretch. Then when you're done, you're then going to switch legs and you'll do the opposite side. And now these stretches are designed to help stretch that lumbar spine, help to open up that canal, to take the pressure off the nerves, really. And the most important thing is that you shouldn't be feeling any discomfort doing this. You're going to the point where you feel that stretch, but you don't have to push it further than that. Hold that. Now the other variation is that you can do the single knee to chest stretch, but you're going to bring it to the opposite side of your chest and you're going to hold that. This is a very good stretch for your lumbar spine as well as the gluteal muscles, and helps to actually stretch out the muscles in the buttocks area, helps to open up that spinal canal, helps to take the stress off of it. And you're going to hold this stretch for 20 to 30 seconds, and you're going to breathe deeply in and out, and you want to do it 2 to 3 times. And then once you've done that, you then want to switch to the other leg and bring it to the opposite side of the chest. And this is a really, really good stretch. And as I've said before, you want to do these stretches on the floor. We're just showing it on a chiropractic table, so it's easier and safer to do it on a floor. So the next stretch, which is a great stretch, is called the figure 4 hip stretch. You can do this seated or lying. We're going to show it to you in a seated position because I prefer getting patients to do it in a seated position. This stretch focuses on the muscles around the hips and the pelvis, which help to play a major role in how stress is transferred from the lower back and the spine. So to begin, you first choose a position that feels comfortable. And as I said, you can do it seated or lying. I prefer the seated position. Gently place one ankle over the opposite knee, forming a figure 4 shape. Make sure you're not forcing the position. The knee should fall naturally, okay? At this point, I don't want you pushing down on the knee. From here, stay upright if seated, okay? Or relaxed if lying down. You should feel a gentle stretch through the hip and the outer glute area, not in the back of the leg, okay? Then, okay, as you want to increase the tension, and this is to your comfort zone, you can lean forward from the hips, okay? And you feel a little more of a stretch. Now to modify this and add more, and again, this is to your comfort zone, you can actually place your hand on the knee and gently push the knee gently towards the floor, and again, leaning forward. But again, you feel that tension, you feel that stretch. You don't want to go beyond that. You don't want to cause any increased pain in the hip, glute, or down the leg. You shouldn't feel any of this stuff. This stretch helps to reduce the tension around the pelvis, helps to improve hip mobility, decrease the stress through the spine. Okay, so you want gentle, sustained stretching, nothing too aggressive. You want to hold this stretch for about 20 to 30 seconds while breathing normally. If you feel any increased symptoms, leg pain, back pressure, discomfort, you want to ease the position, come back a little bit. You should feel relief and controlled motion in this. Now the next stretch we're going to talk about is the cat-cow. This is a great stretch, and so with this one, this is so good because it helps to encourage smooth, controlled movements of the spinal joints. It really helps to improve the circulation around your spine, and it can help the nervous system shift out of a guarded mode. So I find it very good because it also gets you into a calming and breathing state. So basically the premise is you want to be on all fours. Now, if you have issues with regards to your knee being on the floor, then you can use a pillow underneath your knees, and you can place that there to help support your knees. Okay, that's one option. Otherwise, if you don't need the pillow, that's okay. And you want to be on all fours with your hands underneath your shoulders and your knees underneath your hips. So you're in this position. Now, basically the most important thing is knowing when you're going to breathe in and breathe out. So when you exhale, that's when you gently round your spine towards your ceiling. Tuck your chin in and your tailbone, as this is your cat position. Then when you inhale, you allow your spine to gently arch lifting your chest and your tailbone slightly. And this is your cow position. And you move slowly between the two positions for 10 to 15 rounds. So this video is part of a whole series I'm doing on spinal stenosis. So make sure you watch all the videos that are here because I teach you all kinds of different things in every video. It's all relevant. And if you found this video helpful, make sure you like this video. Make sure you subscribe to our channel. My name is Dr. Ali Shariff, and my clinic name is Infinite Healing Chiropractic and Wellness Center, and we are located in Oshawa, Ontario. And we have a busy practice, and our mission is simple. It is to help optimize your potential, help you be the best you can be. So continue watching our videos, continue learning more. I look forward to seeing you on more videos and educating you. Thank you.